we call them as medulla, right? So whenever you are going to see this, you have two components. Inside we have medulla and we have the cortex. Now this particular cortex, which is special in this particular gland, it has three segments to study. Like if you are going to study these layers or these different types of cells that is present into it, we have superficial to deep, we have three layers. We call them as Zona Glomerulosa, then we call them as Zona Fasciculata, and then we call them as Zona Reticularis. So in short we call them as GFR. So superficial to deep. We see these particular layers there which is present based on this. So out of these particular A which we are studying here, having these layers G, F and R. So out of this, if you take this as whole content of this cortex, the F content, which is fasciculata, is really taking the most of the leads. That means 80% of this layer fasciculata is taking it, and the glomerulosa is 10% and this is 5 to 10%. So if you are just going to see this cortex, so this cortex distributions will be 10, 80 and 5. So G, F, R is going to look like this whenever you are going to see the layers which is present in the adrenal cortex. Then we have a very short medulla which is present in here, which is inside to it we have it. Clear? So these two things we are going to see. It has a capsule. So whenever you are going to study it, we have to identify the capsule first. Now how are we going to identify the capsule? This capsule should be present on top of it, and it should have some blood vessels present to it and subcapsular space which may be present in it. Then we have this particular layer which is, we call them as G. Then we have the layer F, and then reticulosa, and then adrenal gland which is known as adrenal medulla. So each of these particular component have got different roles to play in terms of liberating or secreting some kind of enzymes or some kind of neurochemical substances, right? So whenever you are going to see this organ or this particular gland, is easy to identify is that we are going to identify the capsule, then this tissue we call them as parenchyma, which can be divided on inner side medulla, outer side cortex. Cortex have got three sub total regions: Zona Glomerulosa, Fasciculata and Reticularis. Out of this, the middle layer F, Fasciculata, is this maximum load, and G is a kind of like a 10%, A, Reticulosa is like less than 5%, which is taking. How these particular cells are present over there is not important. This identifying the layers is important to us whenever you are identifying it. So whether the cells looks like circular or polyhedral or something, that may be just like important for the pathologist for understanding us in examinations and as well as in anatomy exam. We know the layers, how they are placed according to superficial to deep, and how they are oriented. That is enough for us. So having said that, we just go into this particular visuals of this particular glands. So this suprarenal gland is a tiny gland, less than 10 grams. You see that 5 to 7 grams, there is a result of very small glands are there. So whenever you are going to see that, it has a capsule which is having a deep penetration. So we call them septors, which is penetrating deep into the glands itself. Now this tissue of this gland we call them as parenchyma. So this parenchyma has a superficial part which is the maximum load, and inside to it deeper medulla which is present to it. So the superficial part cortex is the maximum load taking, medulla is a small portion. Out of this particular taking on this particular superficial cortex, which have got three layers into this particular regions. So three layers of this cortex we call them as Zona Glomerulosa, which is taking like a load of like roughly 10 to 15%. 15% it is saying like 10 to 15%. Fasciculata is the middle portion, maximum load which is coming onto cells onto this part. Zona Fasciculata and Reticularis, which is least one or innermost. Then we have this medulla, how this is up there. So if you take this Zona Glomerulosa, the cells which is present, which is below the capsule. So how we are going to identify this particular region? We have this particular blood vessels. We have this adrenal gland receiving the bloods from the adrenal blood vessels or adrenal arteries. So it splits down into branches or adrenal branches or cortical branches. So this particular thing is getting into this, penetrating to this particular capsules and getting in here. As it is getting in here, this is the point we can identify the presence of the capsule to it. And as this particular blood vessels goes down, it creates some kind of sinusoids. So more we reach to the reticularis and this particular medulla, we see these spaces between them, we call them as sinusoidal spaces, which is visible lower down. Upper side is really compact. So glomerulosa, so the cells which is present in this particular region is kind of like arranged in a pattern below this particular capsules, and this particular cells which is like looks like a spherical or rounded kind of cells. But again, it's not a very important feature which we emphasizing on. We just emphasizing on the superficial layer is name of it. And this particular cells secrete some kind of hormone which is known as mineralocorticoids, which is dealing with this particular like balance of the sodium potassium thing in our body. The hormone which is liberated here, we call them as aldosterone, right. Then we have this fasciculata, which is the maximum amount of this particular thickness of the gland is contributed from the cells which is present in here, present in the columns. 2 or 3 layers of the columns may be seen in this particular layer, and this cells which is present in here secretes this particular hormone substance which is known as glucocorticoids, which is dealing with this metabolism of the glucose. Then we have this reticularis, which is the deepest most and least thick layer amongst this superficial layer, which is contributing to 5% of the cortical thickness. Now these particular cells having a reticular pattern, that means they have a branching pattern. So it is branching or having an anastomotic cords which is present here. That's why you call them as reticularis. So these particular cells which is present in this particular regions secretes the hormones which is the sex steroids or androgens, which is present in there. Then we have this medulla, which is the 10% of this particular gland composed of. These particular cells which is present in here, we call them as chromaffin cells, and these cells also known as pheochromocytes. So these cells which is present within this particular medulla is coming from the neural crest cells. So when you're going to talk about this embryological development of the brain and neurological system, we'll talk about some cells we call them as neural crest cells. So these cells comes from very primitive kind of cells, we call them as neural crest cells. So these cells present in this particular adrenal medulla, we call them as pheochromocytes, and these cells secretes kind of like the substance, we call them as catecholamines, adrenaline, noradrenaline. That's it. We don't have to dig nothing more into these particular glands. Now how these things should be looking like. So what we are going to identify, we are going to identify the capsule or this thing which you have starting point. So how to identify this particular cortex and medulla? We are going to identify this layer which is present in here, blood vessels which is present, and these things which is making kind of septas over here. So these things is a beginning or starting point for us. We are going to identify the capsules. Below the capsules we have a layer which is known as G layer. Then we have this particular layer, we call them as F, and then R. Then we have the adrenal medulla which is present. Now whenever you are projected into this particular region, we may not see the whole extent of it. That means from here to here there may be too far whenever you are seeing that. So we may not see the cortex whenever it is highlighted. So you may be seeing this particular capsules first, then we can see up to this particular middle of this particular reticularis, then it is not be visible. Then we have to move the slide to see this particular medulla. So whenever you are seeing this particular slides in anatomical examination, it is tricky because we may not see this capsule to medulla in a single section because it's too long. Whenever you are seeing it, that makes this particular slide is difficult to identify. So whenever seeing this, it looks like this. So whenever you are projecting it, this much of length may not be visible. So maybe just like the capsule, we have to keep to see the starting point. Below that we have this particular layers which is present in here. So this particular structure which is present in here, which is known as the histological picture of this adrenal gland, having this particular capsule, then we have the G, F and R and then medulla. As I am saying again, this medulla may not be seen in the whole section if this tissue is too big. So looking at this capsule and this particular layers deep to it, we have to identification. We have to make this identification call based on this particular cortex only. So keep your mind prepared for this. So we have this capsule, then we have this cortex, then we have medulla. So cortex having got 3 layers, G, F, R, how these things are placed and what are the functions of that, and then medulla which is having kind of cells, pheochromocytes, which is derived of some region of the brain, we call them a neural crest cell, NCC. So this is how this particular thing should be looking like. So In actual picture, this is like we are going to identify these things. So, in a schematic picture, it should be looking like layers like this, but whenever you are going to see this particular thing is apparently looking like this. So, we have 3 slides on us to identify as the adrenal gland or suprarenal. We project it and identify based on capsules and different this is one from I have to identify the capsule, then move up. Capsule, then go down. Identify the capsule, then go down. First you identify the capsule, then slow down.